We want everybody to get the vaccine, but there has to be some way to prioritize how we're going to give these out.
A new path for hope, but for whom and when? Tonight, we're learning more about the state's plan to distribute the COVID-19 vaccines once they are approved by the FDA. The state is waiting on 3 companies reporting promising results. Our ABC 10 News reporter Laura Acevedo explains what we know, how it will work, and how it will go out.
The governor says it's been working on a distribution plan for months, using its experience with mass distribution of other annual vaccines like the flu as a guide. The governor's plan for distributing the COVID-19 vaccines once they are ready puts healthcare workers at the top of the list. In phase 1, the vaccine will also go to people in nursing or assisted living facilities and first responders.
When you have millions of vaccines, it sounds like a lot, but when you have to divide those all across the country, the actual number that each medical center might get can be quite small.
Dr. Michelle Ritter is an infectious disease specialist at UC San Diego Medical Center and the director of the COVID-19 clinic. Governor Newsom also explained that 3 committees are currently looking at the data presented by the drug makers, confirming the vaccines are safe. Dr. Ritter says it's important to trust the science.
We're still getting the same information that we normally would from a trial that lasted much longer. It's just in a much shorter period.
Monday, AstraZeneca reported its vaccine is up to 90% effective. On Friday, Moderna and Pfizer both applied for emergency FDA authorization after reporting that their trials showed their vaccines to be 95 and 90% effective. Pfizer's vaccine will require being stored in extremely cold temperatures that could require things like dry ice, while Moderna's will require freezing that can be done in a traditional freezer.
The fact that certain vaccines may be given in situations or in facilities where they have the freezer capacity to freeze those vaccines, and maybe places that don't have the freezers, they'll send the ones that don't need to be frozen there.
Newsom says further phases of distribution will still take more time, with mass vaccination still months away. With the light at the end of the tunnel, Dr. Ritter says it's important to remember all health guidelines.
I think this is the time that is most crucial. This is the time to know there is an end in sight, perhaps. Let's just try to keep strong near the end here, because otherwise we could end up in real trouble.
Laura Acevedo, ABC 10 News.